All right, so hi everybody. My name is Samantha. I'm a community health manager here with Prevent Blindness Wisconsin, and I'll be going over our UV awareness virtual workshop today. I'm not sure, some of you might be familiar with us more than others, but I'll just start with a brief background on our organization. We were founded in 1958, and a big bulk of the work that we do is centered around vision screening, both for children and adults. And then another big part of what we do is also just health education as well. And so our vision is for each Wisconsin resident to have healthy vision at every stage of life. A little bit more about what we do and those individuals that we partner with. We do partner with the Wisconsin departments throughout the state, shelters, the Department of Public Instruction, various school nurses, Head Starts, childcare centers, private schools, some free and reduced clinics, and then also the Wisconsin Lions Foundation too. And we support these partners throughout the state as they vision screen. We are in all 72 counties, but here are some numbers that kind of show our impact thus far throughout the year. Over 590,000 Wisconsinites have been impacted through our preventative vision health programming. And a little over 64,000 have been served with direct preventative vision health services so far this year. We have implemented about 54 statewide vision screening trainings, and about 34 of our partnership agencies have viewed our online training videos, both for children's vision screening and adult vision screening. And then a little over 1,500 individuals have actually been trained as certified screeners as well. So just a little bit about some of the content that we'll go over today. First, I'll just start off with an overview of the anatomy of the eye. I'll go over some types of UV rays and how they affect the eyes. We'll go into a few vision conditions that are associated with UV rays. And then also, I'll just wrap up with some healthy habits that we can use to protect our eyes as we get into the summer months. So just to start off with the anatomy of the eye, if you've ever attended one of our trainings, we typically go over this too. But typically we just kind of like to point out that there is a whole system working behind the eye. So you can kind of see all these moving parts here. But typically we'll have light enter through the front of the eye, through the lens. It'll hit the back of the eye, travel through this optic nerve. It'll send that message to the brain, and that's the image that we'll see.
Hello.
Hi.
We can't hear.
Oh.
Can't hear you.
Oh gosh. Let's see.
Go ahead, Sam.
Okay.
I'll respond to the chat.
Okay.
You're doing good.
All right. So I'll just move on here. We're just going to transition into talking about the different types of UV rays. Start off with UVA. These typically can hurt our central vision and can do a little bit of damage to the macula, which is along the back of the eye. So just kind of going back to this visual, you can kind of see that along the back of the eye there. And in a little bit, we'll talk a little bit about macular degeneration and the different forms of that. And then with UVB, this will be kind of looking out for the front part of our eye, specifically the cornea and the lens. So just kind of going back to that along the front of the eye. And then we have the lens here too. So with this, the front part of our eye does absorb most of those UVB rays. And this can actually cause a little bit more damage than UVA rays. And in just a little bit, we'll talk about cataracts too, with the lens of the eye. All right, so next we're just going to go into risk factors. Who is at risk for eye damage from the sun? Everybody is, including young children. And then especially those who work or play in the sun for long periods of time can be at the greatest risk. So with this, I even think of individuals who work outside for a living. So that's just a good thing to take note of there. And then also those who have had cataract surgery or maybe have a retina disorder. And then lastly, just those who are on certain medications. So I have listed a few examples there. It's not an all-encompassing list or anything like that, but just a few examples. All right, so then just a little visual here, excess sun exposure can put us at risk for a number of things. So just some examples, cancers of the eye, cataracts, sunburn eyes, and then also growths on or around the eye too. All right, so next we're just gonna get into some vision conditions as it relates to UV rays. The first one will be photokeratitis. The next one will be pterygiums, cancers of the eye, age-related macular degeneration or AMD, and then also cataracts. So the first one is photokeratitis. This will be caused by UV exposure, whether that's sun or man-made. This essentially is a sunburned cornea. So right at the front of the eye, we'll see that. Along with this snow blindness, which is when these UV rays bounce off of snow or ice or things like that. So that's just something to take note of. We can also experience this after watching a solar eclipse. So that's just something to think about with that too. Some symptoms we might notice with this would be pain, redness, blurriness. We might have some sensitivity to bright light or see halos or some bright spots. So treatment with this is really going to be about pain management. So we might want to use a cold compress, artificial tears, maybe some pain relievers, and then also an antibiotic in the form of an eye drop or something like that. So next I'm just going to go into pterygiums. This is going to be a fleshy overgrowth of the conjunctiva. You can see an image here to kind of give you a better idea of that too. Some symptoms we might notice with this would be redness, irritation. You might notice a white or a pink growth that starts to cover the front of the eye. We might notice astigmatism or some blurry vision with that as well. So risk factors for this. Typically, if you live in a warm climate and are exposed to sun quite a bit, you can be at high risk for this. And then as far as treating this, we would use artificial tears, maybe a gel or an ointment to help relieve some of that redness or irritation. And then in some cases, might need surgery, but this is something that can grow back too. So just something to think about that. Okay. Next, I'm just going to go into cancers around the eye. So this will be a malignancy that will grow within the eye. You can see a picture here for an example. I did just want to point out ocular melanoma. That is the most common eye cancer in adults, but it is pretty rare. Some symptoms you might notice is just the change in the size of your pupil. You might notice a growing spot on the iris. You can see that in the picture here along the colorful portion of the eye. You can see that spot there. And then you might notice some floaters or different spots in your vision. As far as treating this, typically surgery or targeted therapy is used, but it'll depend on the case too. Moving into age-related macular degeneration or AMD. I do have a visual for us just right away to kind of show you the difference. The first one is just normal clear vision. And then this one you can see the difference with AMD. You have this kind of dark splotch right here that you can see. We do have two forms that I'm going to cover today. The first is dry AMD. This is the most common form. This can result in permanent vision loss over time. But this is really due to the buildup of drusen or small protein deposits underneath or around the macula. So you can see in the picture below here, we have these protein deposits kind of around the macula there that's causing that. And then just switching gears to wet AMD, this is a more serious form, but it is more rare. And this can actually result in severe vision loss pretty quickly. And this is due to the formation of abnormal blood vessels underneath the macula and surrounding the retina. And these blood vessels might leak blood or other fluids and can cause some scarring to the macula too. So you can see in the picture below here too, you can see those abnormal blood vessels kind of causing this bulge right here. And then you can just kind of see in relation to the rest of the eye, it's along the back here. So what are some risk factors for AMD? Aging and family history, race, smoking status, high blood pressure, obesity, and then also poor diet can all be factors there. And then the last condition I'll go over is cataracts. So what is a cataract? This happens when the lens of the eye becomes cloudy. Your vision may become more blurry because the light stops passing through the retina properly. And you can see just in the visual on the right here, the lens is quite a bit more cloudy than usual. So just something to take note of there. Some symptoms you might notice is just blurred or double vision. You might notice a milky or a yellow colored spot in the pupil as well. And then treatment for this is really just going to be cataract surgery to remove that for us. And then just another visual for us here too. We have one of normal vision, as it should be. And then we have vision with a cataract. So you can see it's quite a bit more blurry, less colorful, so you can see that difference. And then just kind of another visual for us. On the left, we have normal vision. You can see it's quite a bit more, the light passing through is more sharp and would be more clear for us to see. And then vision with a cataract on the right is going to be a lot more dull and less sharp there. And then I'll just wrap up with ways that we can protect our eyes from UV radiation as we move into the summer months here. So the first one is just going to be using eyewear that absorbs UV rays. So sunglasses will filter light and protect our eyes from these UV rays. When we're looking for sunglasses, it's always good to look for ones that do absorb 100% of those rays. Typically when you're looking for sunglasses, they might have a little sticker on them that says, 100% UV protection or something to that effect. So just good to look for those. And then lastly with this, UV protection isn't expensive and it shouldn't get in the way of you seeing clearly. So just some points to think about there. Just another tip is wearing a brimmed hat or a cap. This will also limit the amount of UV rays that reach our eyes, especially like above and on side of your sunglasses. That can really help block those out too. And then just a fun fact, wearing a wide brimmed hat or cap will actually block about half of those UV rays that we see. So just kind of a cool fact there. And then the last one I'd have for us is just limiting exposure to UV rays. So that might mean limiting your exposure between the hours of 10 a.m. and 2 p.m. That's usually when UV rays are at their strongest throughout the day. And then just a point on tanning beds, they do use lamps that emit both UVA and UVB radiation, and this can lead to eye damage or cancers of the eye too. And then just the last one, just to be mindful of the amount of time that you're exposed to these UV rays. But that is really all I had. I don't know if anybody had anything they wanted to add or questions on anything. I also put my email in here too if anybody has any feedback or had any questions too.
I was just kind of curious about the treatment for the macular degeneration. You didn't kind of go over that.
Yeah. So I think I kind of know a little bit about it. We also have Courtney, who's probably a little bit more familiar with that. But I think with dry AMD, there's a little bit you can do with taking different supplements that can kind of help with that a little bit. And then also with wet AMD, which is kind of the more severe side of that, there's anti-VEGF medications that you can take that can kind of help slow those abnormal blood vessels that we get with that. And then I think also laser surgery can also be used on those blood vessels to kind of help with those as well. I don't know, Courtney, if there's anything else. Okay.
Yeah, she really covered it, Megan, but I would say with that, dry eye, nope, wrong one. Dry AMD, like, Sam said, well, they have out there supplements, so they call it basically the AREDS 2 formula. Just a lot of vitamins, minerals trying to work to, prevent further drusen development. And then wet AMD, like she said too, probably the most common is anti-VEGF injections to kind of halt abnormal blood vessel growth. Laser surgeries out there, it's just that can cause a little bit more damage to visual acuity for some clients, because you are, you're zapping tissue in the process. But I would say anti-VEGF is probably the most common for wet AMD. The unfortunate thing with AMD is, Sam talked about the risk factors. The highest risk factor population there is going to be Caucasian women, actually 50 years and older, and primarily those that have blue or green eyes. So it really, really is linked with family history. So they say if you have family history or you fall into, kind of that demographic, make sure you get your eyes checked regularly. They say about every 2 to 4 years for adults. Obviously, depending on your eye doctor if you see them regularly, but that's really going to help with the first line of defense. Once you have the condition, I don't mean to sound sour, but it can go south pretty quickly. So that's why we just like the early intervention piece. But you hit it, Sam, spot on.
Perfect. Did anybody else have anything? Okay.
So yeah, this is Rose. So I'm seeing more advertisement about AMD out there, and I don't know if it's wet or dry and interventions for that. So medications that maybe stop, can hold it at bay of where it's at, or what do you know about those medication interventions?
I would say for that, Rose, so if it is dry AMD, the biggest thing is the AREDS 2 supplement. You can get it over the counter from, any type of local supermarket. If you have family history of it, they are doing studies that say even if you try to take those beforehand,
Yeah.
it's really not going to prevent it if it is kind of in your
Right.
cards and genetics, unfortunately. So that's why they just say go in regularly.
Yeah.
The hope is you can prevent it from going from dry AMD to wet. There does have to be some type of buffer there, so you can't just bam have wet AMD right off the bat. There's got to be some type of drusen there that then causes kind of a response in the body that sends out
Sure.
signals to form more blood vessels, which is wet AMD. So I would say, if it is early stages, yes, be consistent with the supplements they have out there, the AREDS 2. The other thing, I know a little bit more holistically, but they say eat for your eyes is huge. So dark leafy greens is really, really going to help too with either slowing that down or hopefully prevention a little bit longer. So they say spinach, collards, kale, those are all going to be great. They have lutein and that really helps support retina health over time. So that's another one too.
Yeah.
A lot of people think carrots, but they're great to have that, but it really is the dark leafy greens that help the eyes.
Yeah.
over time.
Thanks.
Question.
I do have a question, Courtney. Who's going to be diagnosing about the drusen and or the wet AMD or the dry AMD? Ophthalmologist or who does that? Who is going to be telling? Who's going to be giving the diagnosis?
So that would be an ophthalmologist. Yep. Yep, typically an ophthalmologist will be the one diagnosing that.
Okay.
Yep.
So with the regular eye exams and all the tests, are they going to be able to see that?
Yes, they should be able to tell that. And then, you know, if they need to refer you on to an ophthalmologist, then they'll do that.
Okay, all right. Double checking because I'm like I did take the learning, but I didn't know who is going to be diagnosing that. Thank you.
Yeah, yep. Anything else from anybody? Okay, awesome. Well, thank you all for joining. I hope you have a good rest of your day.